a workshop on building Vietnam's national mental health strategy for the 2015-2020 period took place on August the 4th in Hanoi. The event was organized by Vietnam's Ministry of Health with the participation of delegates from the Ministry of Labor, War Invalids and Social Affairs, the World Health Organization and mental hospitals in the country. Participants reviewed the situation of mental health care in Vietnam as the sector is getting more and more attention from the public. Since 1999, the Vietnamese government has been implementing the National Target Program on mental health. The prioritized program is focused on building a community-based mental health care network across the country. Thanks to the program, people with schizophrenia and epilepsy in the country have received community care and medicinal support, while stigma has been reduced. In addition, the Vietnamese government is actively executing a community-based project to provide social assistance and rehabilitation for people with mental disorders between 2011 and 2020. Apart from mobilizing domestic resources, Vietnamese authorities are boosting cooperation with many international organizations.
Chúng ta còn, nhất là vì chuyên ngành tâm thần chúng tôi thì còn có những cái mình còn có những cái hạn chế về kiến thức trong tâm thần học nói chung thì vậy, nhưng mà chăm sóc sức khỏe tâm thần trong từng lĩnh vực người già, trẻ em rồi thì nghiện chất là những thứ mà mình còn thiếu về kiến thức và kinh nghiệm. Chính vì thế cho nên hợp tác quốc tế trong đào tạo nguồn nhân lực là vô cùng quan trọng. Đào tạo nguồn nhân lực thì có thể mình gửi cán bộ đi học, cũng có thể là mình mời chuyên gia đến đây. Thế thì các cái hợp tác quốc tế đóng vai trò vô cùng quan trọng, đó là chìa khóa kiến thức của nhân loại đến với chúng ta về cái vấn đề này. Thứ hai là các cái cơ sở vật chất, hợp tác quốc tế nhất là với tổ chức y tế thế giới, người ta cũng hỗ trợ cho chúng ta rất nhiều. Ngoài cái việc kiến thức thì về cơ sở vật chất họ cũng giúp chúng ta. Thứ ba nữa là vì có những cái hợp tác quốc tế cho nên là chúng ta có được những đường lối chính sách hợp lý.
Hello and welcome to Sharing Vietnam. Vietnam is trying to improve its mental health care system in order to meet the rising demand of the people. And in order to achieve that target, the enhancement of policies, regulations, and leadership play a very important role. And in our today's program, we will have another conversation with Dr. Harry Minas, a well-known mental health expert from Australia. So, good afternoon, Dr. Minas. Thank you so much for joining us today. So, first of all, could you share some information on the progress of Vietnam's policies and regulations regarding mental health care?
I think Vietnam is making progress in the area of policy for mental health. That change has been happening for quite some time, but the fact that it's not happening quickly is not necessarily a big problem. The sort of changes that need to be made are substantial. There is a program which has been going for quite a number of years. It's the National Target Program on mental health. That program commenced in 1999, and it focuses on developing services to be delivered through commune health stations, so close to where people live. The program focuses attention on two main and quite serious disorders. One is schizophrenia and the other is epilepsy. Now, that program has been rolled out to most, I think, more than 90% of districts and to probably 80% of communes in the country. Now, that program, I think, is a platform for further development of community mental health services. It's not enough by itself, but it's a very good base on which to build. More recently, in 2011, the Prime Minister announced a program which is being managed by Molisa, which is to develop community-based social support for people with mental illness. Now, that's a very large program. It's a very substantial state budget which has been allocated to it.
So, Dr. Minas, those national programs of Vietnam to improve mental health care have been implemented for a number of years now. So, could you give us some information on the efforts to review the results of the programs?
So we have now collected information from a very large number of hospitals, social protection centres, other institutions from right across the country, and from more than half of the commune health stations, so about 5,000 commune health stations. That will give us a lot of information about what's available, what kind of work is being done, what sort of workforce, what sort of human resources are available.
Well, apart from the progress, there are some shortcomings of mental health care in Vietnam. So what are your comments on the shortcomings?
Now, the legal and policy framework in Vietnam is quite complex. There are laws that are made by the National Assembly. There are decisions and directives that are issued by the Prime Minister or by relevant ministers. There are regulations. So there are many pieces of legal, there are legal documents which contain parts of what needs to be done for mental health. And in our view, that needs to be brought together into a comprehensive piece of mental health legislation. And we will be working with the Ministry of Health and with others to advocate for the development of such law.
A training program for mental health leadership took place in Hanoi from October the 6th to the 10th, 2014. The program was one of numerous events to mark the International Day for Mental Health, which falls on October the 10th. The training was provided by the National Institute for Mental Health of Bach Mai Hospital in cooperation with some international partners such as Melbourne University in Australia and Atlantic Philanthropies in the United States. Participants in the program included leaders of mental hospitals and social support centers in Vietnam's northern mountainous provinces. The program contained various topics with a focus on strengthening leadership skills, assessing policies, and determining the need of community-based mental health care in Vietnam. Speakers of the program were specialists from Vietnam and some international organizations such as the World Health Organization, the United Nations Children's Fund, and Australia's Melbourne University.
Qua cái buổi tập huấn này tôi thấy rằng là cái bức tranh về cái hệ thống cũng như là các cái việc triển khai các dịch vụ khám chữa bệnh, chăm sóc sức khỏe tâm thần ở các nước nghèo trong khu vực và Việt Nam có rất nhiều nét giống nhau, cần phải được sắp xếp lại, cần phải được củng cố lại, và cái đó cần phải có sự giúp đỡ không chỉ của Liên Hợp Quốc, của WHO đấy, và đặc biệt là phải có thay đổi được nhận thức từ các nhà quản lý. Các lớp tập huấn này lên được tổ chức nhiều hơn đấy, và mời các cái nhà quản lý, không chỉ các đồng chí giám đốc, phó giám đốc ở các cái đơn vị chuyên khoa, mà mời cả các đồng chí lãnh đạo tỉnh, đấy, lãnh đạo các ngành để đi nghe những cái chương trình này. Và khi đó trên cơ sở đó thì hệ thống cái nhìn nó sẽ rộng hơn, cái tầm nhìn rộng hơn, không chỉ riêng về cái công tác chăm sóc bảo vệ sức khỏe nhân dân nói chung, mà đặc biệt là cái mảng tâm thần nói riêng. Nó cần các cái nguồn lực khác, cần cái sự phối hợp của các cấp các ngành nhiều hơn nữa, thì cần phải có các quyết sách, các chính sách không chỉ từ tuyến trung ương, từ chính phủ, từ các bộ, mà còn phải ở các địa phương nữa.
Well, Dr. Minas, a program with the support of the international community has taken place in Vietnam to improve the policies, regulations, and leadership of mental health care here. So could you give us some major contents of the program?
The implementation of laws and the implementation of policies requires leadership at all levels. Leadership just in the centre is absolutely essential, but it's not enough. There's also a great need for very capable leadership at provincial level, at district level, at commune level, and across all of the different sectors. So a program that we have been running in Melbourne now for 13 or 14 years is a program that teaches leadership for mental health system development. And from that program, we have, with our colleagues here, developed a shorter form of that program so that we can train larger numbers of people from both the health and the social affairs sector.
And Dr. Minas, could you share some of your impressions of the program?
I think one of the most notable things is that the group which is here consists of people with a lot of experience and who are also open to thinking about how can things be done better. That's the first thing which is notable. The second is that there has been within the discussions quite a lot of disagreement about the details.
Okay.
But I see this as a very positive thing because people come from different perspectives. They come from either health or social affairs. They either come from a province which has very limited resources or one which is better off. And so the perspectives that people bring are quite different, and they're different professional disciplines who are here. So I see the very open and spirited discussion which has been happening as the start of a process where we can begin to develop a consensus, to find those things that we can agree on. What are the most important issues? What is the most effective way in which we can approach and deal with those issues? And what are the ways that we can make sure that the agencies, whether they're health or social affairs agencies, are working in the most effective way for the benefit of the population? So it's been very lively discussion. The disagreements are the disagreements are genuine, but they are respectful disagreements, and so I see it as a very positive way of proceeding.
And Dr. Minas, could you share your comments on the impacts of the program on the promulgation and implementation of Vietnam's national mental health strategy for the 2015-2020 period?
The people who are here for this training program and many others will be absolutely key to the implementation of the strategy, because if the strategy is going to be meaningful, it should produce real action and real change at the service level. The people who are here are the ones who are managing or delivering those services. So they need to have a very clear understanding about what are the foundation principles for the strategy. There needs to be consensus about the priorities, and there needs to be agreement about what actions need to be taken in order to bring about improvement. So there is considerable discussion with the group here about that strategy, and then both the challenges for implementation, but also where there are opportunities to implement.
Dr. Minas, thank you very much for joining us again today and sharing valuable information. We look forward to seeing you again in further cooperation programs in Vietnam.
Thank you very much for your interest in this. Thank you.
Well, that's all for our program today. Hopefully, with the active cooperation of the international communities with programs to improve policies, regulations, and leadership, Vietnam will further enhance its mental health care system to meet the rising demand of the people. Thank you for watching and see you again next time.